And Dr. Ashok Seth, he's the Managing Director of Fortis Hospital Group, and also Dr. Bagai. I want to come to both of you first. A graded exit plan is probably the way to go, and most states, most cities are believing that's the way to go. I want to ask you, Dr. Ashok Seth, how are those cities, especially like Delhi and Mumbai, who have a higher rate? And before I come to you, let me unveil the number for these cities. Chennai on May 3rd will have a peak of 229. On May 14th, it will be 259. So that's only 30 cases extra in the 11 days. Mumbai, 4,014 on May 13 and 5,816 on May 14. Bengaluru, 167 to 204. Hyderabad, 309 to about 407. And Delhi numbers we've already put out for you. So, Dr. Ashok Seth, I want to ask you, Mumbai, Delhi are the two cities where there will be a lot of economic activity, but these are also the cities that have probably cases which are on the higher side in the country. How will these places have to deal with their lockdown strategy as well as, economic activity, restart, reboot activities?
So let me just come in by saying that, firstly, of course, your mathematical model is great. I think we compliment you for that. It actually provides us a good guidance about policies and perhaps what to expect, maybe. But sometimes it leaves us half knowledgeable as well. And that's primarily because it does not factor in many of the issues which actually it relies on assumption. The good fact is that it actually takes into account what's happened over the last 3 weeks of the lockdown. And therefore, that's true Indian data on which this mathematical model is being built. But let me also say that the variables are hopefully around the corner for us. And as we say that, what we're talking about is a fact that doesn't take into account whether temperature variations would do anything, whether compliance to the lockdown would actually change any issues, whether there are other factors which are influencing this. And I think, therefore, what we really need to do is watch it weekly. While we can't plan economics on a weekly basis, but we can certainly strategize around the lockdown as we see how the mathematical model fits in with reality over next week. And certainly our policies need to change week by week as we see the reality in front of our eyes. Having said that, I must also tell you one more thing, and this for Delhi and maybe for Mumbai. Mumbai, clearly, more testing is being done, more cases are being uncovered, and hopefully stricter issues and norms are being put into place. And that's another thing which changes the mathematical model over a period of time. For Delhi, some of these numbers which are projected could also be as a result of the Nizamuddin cluster creating a huge rise in the last few days. And yet again, we see in the last couple of days plateauing out. Having said that, I must also emphasize the very important thought processes which come to mind. That as we actually see these guidance and compliances coming in, we got to be very clear about one fact which I keep asking, and we are now into 6 weeks from the Italian group which caught this virus, the international travelers who came here, and I think more than 2 months away from the first case in Kerala. When I speak to my colleagues in the United States and England, they at this time are overpowered with serious COVID cases, and I'm not talking about cough and sore throats. Their ICUs are full. They just don't know where to put these patients. There are patients on the ventilator. And the good part at the moment is that India, the situation is still manageable. Now, we can say that's part of the lockdown itself. And I totally compliment the lockdown and believe that that's a major part of why we're seeing lesser cases. But truly, when I speak to my colleagues in the tier 2 cities, we're not seeing the serious cases on ventilators. The last projection was that there were no more than 40 cases on ventilator, perhaps in the country, which is so different 6 weeks later to what it is in the West. So maybe that there is something else which is working. We can't rely on it. We can't put our hand on it, but we actually have to hope that there are other factors working in our favor. We still have to be not complacent about it. We have to work on this mathematical model.
Is the entire fight now down to a hope and a prayer? Because really, we are not getting Any news of a vaccine coming up soon? There are divided views on the use of hydroxychloroquine. Also, many people are now looking at the plasma therapy and whether that could be the answer. The issue really here is, how do we plan through these mathematical projections for the future? Delhi still showing, possibility of an exponential growth. Uttar Pradesh showing the possibility of an exponential growth. How are the different states behaving? And, if you look at down south, Kerala has made a turnaround much faster. Are there any studies? Because Hyderabad, Tamil Nadu, Kerala, Andhra Pradesh have all managed to, keep a lid on the growth of cases. Is there a north-south divide in the behavior? Are there any reasons for this? Or is there a common model that can be adopted across the country?
So there is clearly no common model, and that's why I think your mathematical model is very important. You've got to be prepared for the worst, and that model perhaps clarifies the worst of the situation, and we're hoping for better situations than that. So we've got to actually be prepared. It's almost an eerie feeling, to tell you frankly, despite what I was saying. As we hear what is from the west, it's almost like we've shuttered our windows. We're actually in the path of a hurricane, and we're just waiting for the hurricane around the corner. And every day we're praying that it doesn't come. Let's hope that happens.
Well, we're hoping to keep the hurricane away. But Dr. Bagai, what are your thoughts on this?
Hi, Navika. Very quickly, I think most of the Western systems, as far as the medical fraternity is concerned, it's been a medical carnage. They've been overwhelmed. I agree with Dr. Seth. I have a lot of my friends and colleagues there. They've never seen this kind of a tornado which has swept away patients right in front of their eyes. Never in their life have they seen it. Never have in our lives have we read about it in this manner. But with regards the projections and these numbers and the study, I'll tell you why I'm very confident that this lockdown is working and it will sustain to work. At the present moment, we are seeing a case fatality or a RO of just over 3. I think this number is high because your denominator for your division is low. I must add that we are relying only on the PCR test, which has a maximum sensitivity nearing 67 to 70% only. And that also depends upon the timing of the day of the test in your illness. Now, we have not included the ELISA test in our analysis, and that's why your denominator is getting skewed, and therefore your death rate, which is being projected, is still high. If you include that, your overall sensitivity reaches 88 to 90%. That's part one. Part two is, I think, with regards to the lockdown, when we are going to exit, it's graded on 20th and then graded on 3rd of next month. It's a 80-20 formula. I think it's a fine balance between what we have achieved medically, what we have achieved in terms of saving thousands of lives, and what we are losing out economically. Now, to gain that extra 20%, we should not lose out 80% overall on the economy, because poverty and hunger are the two greatest diseases, at least in the Indian subcontinent. The last point which I want to make is, just in sheer comparison, we unfortunately have lost, every human life is valuable, about 430 to 440 Indian lives. Compared to US, more than 35 to 36,000, considering just 2 points in comparison. As far as the population is concerned in terms of numbers and the population density, if you factor that as a simple ratio, if our lockdown was not here, our numbers of case fatality would have been in many hundred thousands. I don't even want to quote the figure because there is no point in creating anxiety. I think our social behavior is going to decide our next 2 months, 3 months panning out of this disease. We have to allow this to burn out. Corona is here to stay for a few months, maybe a couple of years, but we have to allow to pan out. I know that there are research happening right now for innate immunity, ambient temperature, BCGs, but those are still under study. So I don't want to pin any projection on hope, which is just random assumptions. At the present moment, it's working. We need to stay united. We need to follow the government guidelines, get our infrastructure ready, which already is, and
hope for the best. So let me also get in